Hi everyone, I'm Dr. David Bernstein and I wanted to welcome you back to our series 25 Tips for Working with Modes. Okay, now last time we discussed the importance of slowing things down, buying yourself a few moments in the heat of the moment to observe the patient's mode, to notice your own reactions and recruit your healthy adult mode. Okay, and then what? Well, you need to bring your attention back to the patient. You need to observe the patient's mode again. And ask yourself the question, which mode is it? How do I decide, how do I determine which mode I have here in front of me? And that brings us to our third tip, which is, it's in the details. And in order to determine which mode you're dealing with, I suggest that you go through a simple 4-step process. And the first is, which emotion am I observing here in this mode? The second is, which type of mode is it? Which category of mode? Is it a child mode or a parent mode? Or is it a coping mode or a healthy mode? The third step is that sometimes it helps to ask yourself which kind of theme is associated with this mode. And these themes in schema therapy we refer to as early maladaptive schemas, these kinds of long-term themes or patterns that run through someone's life. And then the fourth step is, how do I feel when I encounter this mode? Okay. Now what I'd like to do now is go through a series of 4 pairs of images, all of which are taken from our iModes tool. And I want to use this exercise to help you to make some of these determinations and go through this step-by-step process. Okay. So let's take the first pair. Here on the left we have the anger protector mode, which we've seen before, right? It's a mode that basically keeps people at a distance through controlled anger or hostility. Now here on the right is another mode that makes distance. This is the detached protector mode. Now the detached protector mode has a similar function as the anger protector. It's an avoidant mode, just like the anger protector, but it works in a different way. Essentially what it does is it essentially detaches from one's emotions, right? So the person feels numb or feels nothing. And when you observe the person, you see an absence of emotion. Okay, so both of these are modes with the same function, avoidant coping, but they work in different ways. And the way you distinguish them is by the emotion, the indirect anger for the angry protector and the absence of emotion for the detached protector. Okay, let's go on to the second pair. Now here we have 2 modes, both of which involve the same emotion, namely anger. And here on the left, you see the angry child mode. And because it's a child mode, the angry child mode involves the open expression of emotion. Child modes involve basic emotions. And when people are in child modes, we can sense that, we can feel it, we can see it. They're not taking any pains to hide it from us. And so the mode on the left, the angry child mode, is a mode that involves the ventilation of emotion. It's a mode that needs to get the anger out, and it makes a kind of protest, a protest over themes of injustice or unfairness. It's kind of protest mode. And here again on the right is the anger protector mode. Now it also involves anger, but in a very different way, has a very different function or purpose. It uses anger to keep people at a distance. So again, same emotion, but different function or purpose. And the reason for that is that these are different types of modes. The mode on the left is a child mode, the angry child, whereas the mode on the right is a coping mode, right, that protects the person, the anger protector mode. Okay, now let's go on to our third pair. Now here you see 2 modes, both of which are very obviously child modes. And we know that because, you can just see and feel the emotions that are attached to them. And furthermore, you can see that these involve vulnerable or painful emotions and a particular emotion, and that is sadness. Both of these modes involve sadness. Now, how do you tell the difference between the 2? Well, by the themes that are involved here. The theme on the left is one of abandonment. This is the abandoned child mode. The person has a sense of longing or loss or desperation, as if they've been abandoned. And here on the right is the lonely child mode. This is a mode involving themes of loneliness or isolation or emotional deprivation. These themes, abandonment, emotional deprivation, are what we in schema therapy refer to as early maladaptive schemas, long-term themes or repeating patterns running through someone's life. Okay, so again, here, two very similar modes. They even involve more or less the same emotion, but we can distinguish between them by looking at the themes that are involved, or in other words, the early maladaptive schemas. Okay, now, last but not least, the fourth step is, how do I feel when I encounter this person's mode? And here on the left, we have a mode, the self-aggrandizer mode, the mode that makes itself powerful and dominant. It's a one-up mode, a mode that tries to take control. It's an overcompensatory coping mode. And when we encounter this mode, maybe depending on who we are, we might feel small or inferior. This can be a mode that tries to put us down. And here on the right, we have the opposite. We have the compliant surrenderer mode. This is a mode that puts itself down. This is a mode that basically takes the one down position. Now, how are you going to feel when you're with that mode? Well, maybe you have a patient in therapy who's, in a compliant surrender mode. They're very eager to please you. And, maybe that can feel nice, for example, because, there's a patient who's, doing, her homework or his homework, unlike a lot of your other patients, they're out to please you. But at the same time, it can be a frustrating mode to deal with because it's very hard to get to what's behind that, who really is this person. So again, these are modes that, have different functions in the, interpersonal space with you, in the here and now, the therapy session or on a ward. And your reaction to them, as we talked about last time, may say something about you and your own past and your own personal makeup and what you experienced growing up, your wounds, how you coped with them. But these modes also tell us something about, the patient, what mode they're in. So just pay attention to your emotional response also to the patient's mode and try to tease apart, how much of this is coming from the patient and how much of it is coming from me. Okay, so we went through this 4-step process, and now you know how to determine which mode you have there in front of you. And now what next? Well, sometimes you want to be able to talk to the patient about his modes or her modes, sometimes even confront the patient about their modes. So that brings us to our 4th tip for next time: talk the talk. And finally, I'd like to invite you to visit our website, www.imodes.com, and look at our image-based therapy tools. Okay, see you next time.